right, well, good morning, everybody. Thank you all so much for coming out here today to talk about the continuing strides that we are making in our city. And over the last few years here in Louisville, we've seen Louisville make a lot of progress, and you can see that as you go around. Our economy is booming, wages are up. There's $13 billion of investment happening throughout our city. Our city's becoming safer as well. We've seen dramatic reductions in homicides as our overall crime rates are falling. And these are all great successes that we can be excited about here in our city. Our goals are to protect the safety of the public while helping every Louisvillian making sure they feel like they have the opportunity to realize their full human potential. And that certainly includes people struggling with substance use disorder. The program that we're announcing here today supports both of these goals. Louisville is launching a program called LEAD, which stands for Law Enforcement Assisted Diversion. We're launching this pilot with the help of a $400,000 grant from the Federal Bureau of Justice Assistance. This harm reduction program is designed for nonviolent offenders who are struggling with opioid use disorder. In many cases, these folks mean no harm. They're struggling with the disease. I'm proud of our city, the way we're able to talk about that more as a brain disease issue. Throwing them into jails and courts that are already overcrowded and backlogged doesn't serve their needs or the city's needs. We've spent a lot of time, obviously, in this area around opioids and heroin, all type of substance misuse, trying to understand what global best practices are. The pilot program that we're announcing here today is modeled after one started in Seattle several years ago. And an independent study there found that LEAD participants were 58% less likely to be arrested after being enrolled in the program. So good results. We've been studying LEAD since 2015, and members of our team performed a site visit to Seattle to learn more about how the program works and to see it in action. This program, the LEAD program, requires the dedication of several partners, and we're good at partnerships here in our city, fortunately. Many of our partners are joining us here on stage this morning. For the past several months, the planning team has been working diligently to put the implementation plan together, including a process for case management and data collection. I want to acknowledge all these valuable partners, starting with the Metro Criminal Justice Commission and its fine director, Kim Allen, who's keeping a low profile in the audience right now. But let's hear it for Kim. She does a great job for our city. Thank you. I also want to thank Jamie Allen and Deborah McGill, who've been working on this effort for months, so thanks to you all. Also, Louisville Metro Police, Louisville Metro Public Health and Wellness, the Jefferson County and Commonwealth Attorneys, Public Defenders, Metro Corrections, REACH of Louisville, the Harm Reduction Coalition, the Public Defender's Office, the VOA, and the University of Louisville. So you can see this is an all-in project here. And I've got to say, as we've been working on a lot of challenges we have in our city, but particularly when it comes to issues around substance misuse, everybody comes to the table and is there just to say, how can we help? And so when we lead up to a big announcement like this today and get large grants like this, it's a really commendation for a lot of good work, really well done. We're confident that the LEAD program will save our city money, time, resources. It aligns with our three core city values as well. When you think about compassion and health and lifelong learning, it all comes together in the LEAD program. It's the right thing to do from a moral perspective. It helps us with problems that we have, like reducing overcrowding in our jail, and it also frees up LMPD officers to continue their work to keep our city safe. So it's a real benefit in many different ways. LEAD also aligns with our overall public health strategy for dealing with the opioid crisis. And that strategy includes training and equipping all of our first responders with life-saving naloxone, and also creating the Office of Addiction Services to coordinate our efforts. Also, you all are aware of our 2-year action plan to address substance use disorder in Louisville, called Coming Together for Hope, Healing, and Recovery. We released that this past March. Overdoses are down year to date in Louisville in the 25 to 30% range, which is good news. We'd like to think that we could understand all of the reasons behind that, One we clearly think is helping is the availability of naloxone, Narcan, with all of our first responders, and then many private citizens in our city as well. So that's one way to attack the problem. Obviously, there's many other more holistic ways to attack it as well, and we're going to do that, and you're going to hear more about that this morning. So I'd like now to turn it over to some of our partners to explain the details of how the program will be operated and evaluated. First up is Lieutenant Mike Sullivan with LMPD to discuss our police officer's role. Colonel Sullivan.
Good morning, everybody. Thank you, Mayor Fisher. First off, I want to start off by thanking the Criminal Justice Commission. Without their efforts, coordinating all the moving parts of this initiative, I don't think we would have ever gotten till today, to this point. And we've been working on it for a very long time. There's a lot of people in this room and a lot of partners here that have got us across or to the starting line of this program here. So we started in July 2015, and that was with a trip to the White House. And a number of people who went on that trip are in this room today. And it was a chance for us to meet with the communities in the country that were already in a lead process and kind of to learn what that process was. And what we discovered was this evidence-based program was something that we were interested in pursuing further. We followed up that visit with a visit to Seattle to see the program in action on the ground. And what we observed was officers and caseworkers doing amazing work, compassionate work, the kind of work that we wanted to see brought here to Louisville. And absolutely confirmed what we discovered in DC and made our commitment to bring this here very firm. Now, our officers come into contact with people every day at the intersection of criminal activity and drug use. And up till now, officers had but one option, and that was arrest them and take them to jail. Now, through this program, officers have a tool to divert people from jail and help them get the help that they need. Now, during this pilot phase, which is set to operate over the next 18 months in targeted beats in the Russell and Portland neighborhoods, we'll work to identify candidates that we can put into the program. And we'll identify these individuals after we've made contact with them where we could make arrests for certain offenses. And those offenses could be, or are going to be, possession of an opiate or possession of heroin under 2 grams. We'll also look for low-level property crimes related to addiction, where we can divert those individuals as well. Those who meet the lead, that criteria, may be offered a chance to enter the program voluntarily. If they accept, instead of going to jail, our officers will take them to a Volunteers of America location where they will be connected with a lead case manager. Now, this case manager will determine their needs and connect them with services. And I think that's a very important part about this program. It's an immediate connection that we're making with that person in crisis, in need, with that case manager right then and there. And it's an important part of this program. And what it does is keep people away from that revolving cycle of arrest, incarceration, and then release. That's expensive, inefficient, and ineffective. And I'd like to introduce Jennifer Hancock from Volunteers of America, who's obviously a key partner in this, managing the case management piece of this program.
Thank you. Well, good morning, everyone. I'm Jennifer Hancock, the President and CEO of Volunteers of America Mid-States. LEAD is truly a cutting-edge program, and we wouldn't be announcing it today without cutting-edge leadership. Mayor Fisher, LMPD, and all of our partners here, we are so pleased to have been selected to partner with you on this important project. We are, in fact, honored to be working with you on this project. I thank you for caring so much about our city that you're investing in this innovative new program. And I'm thrilled that we'll also be working with members of Metro Council, especially Councilwoman Bryant Hamilton, Councilwoman Sexton Smith, and Council President David James, whose district is home to our program. You never let down the people we serve, so thank all of you for your support, for your friendship, and your leadership. And of course, thank you to our partners at the University of Louisville. Their work is going to be essential to our success. At Volunteers of America, we place tremendous value on evaluation, and we're data-driven in all that we do. From the way we design comprehensive solutions to treat addiction in our city, to the way we improve our outcomes year over year to ensure our services are working. At Volunteers of America, we're confident that LEAD will make Louisville a safer city and a healthier city. That's because the beauty of the LEAD program is that it understands that public health and public safety must go hand in hand. So here's how we'll serve participants in the LEAD program. When LMPD identifies a candidate for intervention, we'll be waiting and ready to provide on-demand, immediate, and comprehensive wraparound services. Our office at 2500 West Broadway will serve as the intake and triage center for eligible participants. We'll provide those on-demand initial assessment services for the candidate and make our comprehensive program available immediately. I think Volunteers of America is uniquely qualified because of the wide array of addiction recovery, public health, and housing services we're already offering in our community. Whether providing residential treatment, intensive outpatient services, comprehensive case management, family counseling, psychiatric services, workforce reentry services, or housing, we'll be there to assess and assist every individual who comes through the door. Our programs that treat addiction and that we call VOA Recovery, we provide accredited best practice treatment that focuses on proven and measurable results for our clients. As has been demonstrated in cities like Seattle that utilize the LEAD model, we expect recidivism to decline. And that's not the only outcome. We'll build stronger relationships between all stakeholders involved in this program because on this topic, we stand united. And LMPD can devote more resources to other essential priorities for our city, rather than being tied up with arrest and bookings of individuals who need treatment. These are all important outcomes for our city. So we're ready and eager to get started, because I know that when we surround opioid users with treatment solutions, instead of surrounding them with the bars of a jail, we are taking real steps to solve this public health crisis. When we surround opioid users with the kind of evidence-based treatment and comprehensive services that we provide, we begin to solve this public health crisis. And that makes Louisville a safer, stronger city. It makes Louisville a more compassionate city. We can't look the other way and hope we find solutions for our friends and neighbors struggling with opioid use and addiction. LEAD looks the problem in the eye and offers hope and real answers and a better future. So I say to my colleagues here this morning, we're ready to go, and thank you for inviting us to be part of a solution that will soon make our city so proud. So now it is my pleasure to introduce to you Dr. Liza Creel from the University of Louisville, who is our principal investigator on this project. Dr. Creel.
Thank you, Jennifer. Dr. Susan Buccino and I, along with the Commonwealth Institute of Kentucky, are excited to partner with the Criminal Justice Commission and all of the LEAD partner organizations to study the implementation and outcomes of the Louisville LEAD pilot. This pilot program, as you have heard, is a replication of one started in Seattle, Washington. An independent evaluation there found significant reductions in arrests, jail bookings, jail days, felony cases, and cost associated with LEAD participation compared to a group of individuals that were not served through LEAD. In our evaluation of the Louisville LEAD pilot, we intend to build on the findings from Seattle to understand the implementation and impact of LEAD in our community, and to contribute to the larger body of knowledge about LEAD. Our research team will look specifically at the impact of LEAD on recidivism, including arrests and charges, use of publicly funded legal and criminal justice services, cost to the local criminal justice system, use of treatment and other services after LEAD enrollment, and fidelity to the Seattle model, which really just means the extent to which the implementation in Louisville aligns with the model implemented in Seattle. Our evaluation work would not be possible without the strong partnerships of many organizations in this room, including the Criminal Justice Commission, Louisville Metro Police Department, Volunteers of America, Metro Health and Wellness, and many of the community organizations that will provide wraparound services for LEAD participants. Each of these agencies are helping us ensure we have the data elements necessary for assessing the impact of LEAD in Louisville. Many thanks to each of you for your ongoing partnership and for your future collaboration. Before turning back to Mayor Fisher, I'd like to speak briefly to the implementation timeline for the LEAD pilot. The LEAD planning team is in the process of finalizing operational protocols and implementation details. Officer and case manager training will begin soon and will include cross-training across participating agencies. Finally, we expect the 18-month LEAD pilot to officially launch on October 1st. The University of Louisville is committed to enhancing the well-being of our city through research and collaboration. We look forward to sharing our evaluation findings over the next 2 years. Thank you.
Okay, so it's a big program that we've worked a long time to do, and hopefully will add to all the other efforts we have in this area. We've got a great team that's continuing to work on this. I'd like to recognize Mark Bolton over here, the director of Louisville Metro Corrections. Mark is recognized throughout the country for his progressive activities within Metro Corrections in terms of treating the whole person as they come in, and a lot of the work that you've done around substance misuse has been really extraordinary. So I want to say thank you for the tremendous work that you've done, Mark. Likewise, our chief health strategist, Dr. Sarah Moyer back here. Again, a lot of cities want to kind of look the other way when they've got issues, whether it's on hepatitis C, hepatitis A, substance misuse. Dr. Moyer, you've led us in a really forthright and strong way, and our results are showing for that. So thank you for the good work that you're doing. I also want to thank Commonwealth Attorney Tom Wine for being here. You're a great partner in all these efforts as well as our colleague Michael Connell over here, our county attorney. So thanks to the entire team for being here. Our Metro Council is a big part of this as well. I'd like to recognize Councilman Bill Hollander, Metro Council President David James. Thank you for being here. And now speaking on behalf of the council is Councilwoman Barbara Sexton Smith. Councilwoman.
Yes, thank you, Mayor. So yes, as Councilwoman representing District 4, it truly is a pleasure and an honor to serve not just the district that I represent, but to serve alongside Councilman Bill Hollander, who's with us here today, and Council President David James. Part of the Metro Council's responsibility is to constantly inform ourselves about what are the major problems and issues throughout Jefferson County. Some of these issues impact certain council districts more than others. And the other part of our responsibility is to constantly inform and connect and inspire everyone that lives in the county, to lift folks up and give them hope that solutions are on the way. We spent a lot of time in the last couple of years being inundated with problem promoters, folks who are constantly pointing out things that are wrong in the community and everything that's wrong, but seldom are the same folks bringing forth the solutions. So it is an honor to stand here today, flanked all the way across this stage, and many of you seated in the audience, solution seekers, folks who raised their hand and said, I'll be part of that solution. I'll work a little extra. I'll go find an extra grant. I'll go do this. You know who you are. And for that, I am grateful. We have seen some tremendous successes in LMPD Division 1 during this last year. And the Portland and Russell neighborhoods where this pilot program will take place, there will be targeted beats, as Officer Sullivan mentioned to us earlier. Those beats are going to be concentrated in Metro Council District 4 and Metro Council District 5, which is represented by Councilwoman Sherry Bryan Hamilton. And as I think about the needs in that area, I also think about the number one problem or concern in our community last year as it related to safety. Every day, each of our council districts. We were receiving communications, whether it was in meetings, on sidewalks, phone calls, text messages, and emails, about folks that were so concerned about the homicide rate. Ladies and gentlemen, it is great to be able to stand here today and bring forth the facts and the data. In Louisville Metro Police Division 1, where this pilot program will take place, the homicide rate has seen a dramatic decrease. We have experienced a 70% decrease in homicides in that one division. That is something, right, to applaud and be proud of. That happened for the same reason that the LEAD pilot program will be successful. I am completely convinced that this program will be successful in Louisville, Kentucky, and we will become the standard for other states and commonwealths and cities across the nation to follow our lead on how do you identify the problem, how do you bring the funding, how do you bring all the resources, and how do you hit the ground and take your time and do it one person at a time. As we collect the data, I'm so thrilled that the University of Louisville is on task. I'm a proud graduate of the University of Louisville. I know President James is a major Card fan, if I remember that correctly, sir. And I do know that we will have a lot of data, but remember, with every data point, there's a person. That's what LEAD is about for me. LEAD is about one person helping one person, one moment at a time. One police officer encountering one person with a drug-related low-level offense that does not need to go to the jail. Director Mark Bolton is trying to run an operation that has room for 1,793 folks in our jail. On any given night, his data tells him that there are 2,200 people in the jail. Jail overcrowding produces an unsafe environment. It is all of our responsibility to think about safety, not only in the streets of Jefferson County, but inside the buildings. Don't you think our jail should be a safe place for folks to be? Another thing that the LEAD pilot program will do for us is it will take one officer meeting one person in one moment that needs help with their addiction. The last place you want your loved one to go, or you to go for that matter, if you're the one having the conversation with the police officer, the last place you want to go is the jail. However, the good news is our jail, under Director Mark Bolton's direction, is fully equipped with a full-scale medical facility to treat addiction and recovery. As a matter of fact, it's the largest recovery addiction treatment facility for men in the region. Something's wrong with that. Some folks say, build a bigger jail. I say, absolutely not. Build more programs like LEAD that diverts people from jail into the treatment facilities where they need to be. So I commend Mayor Fisher for creating an environment as our leader of Metro Louisville, working along with Chief Conrad at LMPD and Sullivan and all the others that have come together to make this a reality and make it possible. Together, we really will create a great connected community where everyone feels safe, healthy, educated, and free from oppression, free from poverty, and free from addiction. So Mayor Fisher, on behalf of the Metro Council, I extend my heartfelt gratitude and thanks to you for your leadership. Thank you and congratulations for making this a reality.